Hello, and welcome to the Dual Eligible Special Needs Plan Basics Seminar presented by Sentara Medicare. Here at Sentara Medicare, we understand finding the right dual eligible special needs plan can be difficult. In this presentation, we will focus on the parts of Medicare, enrollment periods, and dual eligibility, as well as extra benefits of having a Medicare Advantage plan. It is our goal to help you understand the basics of Medicare, including the options you have as a Medicare beneficiary. Original Medicare was established in 1965. It's a health insurance program run by the federal government. Medicare is regulated by the Centers for Medicare and Medicaid, also known as CMS. You may be familiar with the Social Security Administration in some capacity. This office manages the Medicare program by handling enrollments for Parts A and B. The Social Security Administration also provides general information to the public so they can better understand their Medicare rights and responsibilities. It's important to understand that Medicare is healthcare coverage available to individuals who are 65 or older, people with certain disabilities, or people with end-stage renal disease, permanent kidney failure. Medicare, in its original form, provides two kinds of insurance: Part A, hospital or inpatient insurance, and Part B, medical or outpatient insurance. There are two additional parts to Medicare, which are Parts C and D. We will cover those areas of Medicare shortly. Let's discuss the four parts of Medicare. First is Medicare Part A, which is the hospital insurance coverage. Part A mainly covers inpatient care, skilled nursing facilities, home health care, and hospice programs. Most beneficiaries do not have to pay a premium for Part A. Medicare Part B is your medical insurance coverage. This portion covers outpatient care, including physician services, diagnostic services, ambulance, and certain limited drugs, as well as durable medical equipment. Here's a tip to help you remember which services are covered under these two parts of Medicare. Part A covers services that are completed in the inpatient hospital stay and follow-up care. Part B covers services completed outside of the hospital, including doctor's visits and certain limited drugs. Medicare Part C is Medicare Advantage Plan coverage, which covers Part A and Part B benefits. This is not a plan offered by Original Medicare, but rather private plans such as Sentara Medicare, who have a contract with CMS to administer Part C plans to Medicare beneficiaries. These Medicare Advantage plans typically offer benefits beyond what is offered by Parts A and B, such as dental, vision, and hearing. These plans may or may not require a monthly premium. Part D covers the prescription drug benefits. You can add Part D to your original Medicare coverage as a standalone plan. You may also have Part D coverage included in a Medicare Advantage plan. Beneficiaries can apply for extra help, which can be applied toward Part D plan premiums. This is a list of benefits not covered under Original Medicare. Medicare does not cover benefits such as long-term care, most dental care, eye examinations related to prescribing glasses, dentures, cosmetic surgery, acupuncture, hearing aids and exams for fitting, or routine foot care. You can have access to these benefits by joining a Medicare Advantage plan, such as Sentara Community Complete or Sentara Community Complete Select. There are specific enrollment times for Medicare. If you are eligible for both Medicare and Medicaid, you may want to use a special enrollment period to enroll in a dual eligible special needs plan. Most beneficiaries have the standard enrollment periods and may only enroll in or change plans during an election period that occurs at specific times of the year. Your previous Medicare health plan elections will impact which Medicare choices are available to you throughout the year. The initial enrollment period, IEP, is a 7-month period that begins 3 months before the month you turn 65, includes the month you turn 65, and ends 3 months after the month you turn 65. The annual enrollment period, AEP, occurs every year from October 15th through December 7th. During this time, you may change your Medicare medical and/or prescription drug coverage for the following year. This includes returning to original Medicare Parts A and B or joining a Medicare Advantage plan. Any changes you make during an AEP attestation will begin on January 1st of the following year. The open enrollment period occurs every year from January 1st through March 31st. If you are in a Medicare Advantage plan, you can switch to a different Medicare Advantage plan or switch back to original Medicare and join a Part D prescription drug plan once during this period. Any changes will take effect on the 1st of the following month. You can enroll during a special enrollment period, SEP, when certain events happen in your life or if you have other special situations. Special enrollment periods, also known as SEPs, are enrollment periods when you can make changes to your Medicare Advantage plan and Part D drug coverage. SEPs can be used throughout the year as certain life events occur. Examples of these life events include moving, losing other insurance coverage, entering a nursing home, or being misinformed when you signed up for Medicare coverage. SEPs can also be used for other special circumstances, like being eligible for Medicare and Medicaid, or qualifying for extra help. If you have Medicaid or receive extra help paying for your Medicare prescription drug coverage, you may be able to join, switch, or drop your Medicare Advantage plan or Medicare prescription drug coverage one time each month beginning in January of each year. If you make a change, it will begin the first day of the following month. Let's discuss the Virginia Medicaid program. The Department of Medical Assistance Services, also known as DMAS, is the agency that administers all Medicaid and famous health insurance benefit programs in Virginia through Cardinal Care Managed Care. Families and individuals meeting income and other eligibility requirements may be eligible to receive health benefits through a variety of programs. As mentioned, there are a variety of programs that you may qualify for under the Virginia Medicaid program. A person could be eligible for some level of Medicaid but not qualify for all the programs that are offered through Cardinal Care. A program I would like to go over is a program from the Virginia Department of Medical Assistance Services, DMAS, Medicaid Health Plan Program, designed for all eligible low-income Virginians, including older adults, children and adults with disabilities, and individuals receiving long-term care services and support who were under the Commonwealth Coordinated Care Plus CCC Plus program. To achieve access to continuous care for Cardinal Care members, select health plans provide managed care services through their network of hospitals and medical providers. The Medicaid plan offered by Sentara Health Plans is called Sentara Community Plan. We offer care management that provides a high-touch, customized plan where members benefit from a personal care team, providing them with the support they can count on in their community. Initially, DMAS will choose a health plan for each person in Cardinal Care. However, you have the right to choose a different health plan. You know your health needs best, so it's better if you choose. You can change your Virginia Medicaid health plan in the first 90 days after you become a member, during open enrollment, and at other times during the year if approved by DMAS. Find out what dual eligible special needs plans are, whether you're eligible, how the plan works, and which extra benefits are included. When a beneficiary qualifies for both Medicare and Medicaid, they are considered dual eligible. They can have two forms of health insurance at the same time. This allows access to extra benefits through a dual eligible special needs plan like Sentara Community Complete or Sentara Community Complete Select. When you are enrolled in Medicare through Sentara Community Complete or Sentara Community Complete Select, and in Medicaid through the Sentara Community Plan, you get the best of both worlds. You will receive seamless coordination of your Medicare and Medicaid benefits, working with the same care coordinator for Medicare and Medicaid. This person will work with you and your provider to make sure you get the care you need. Prescription drug coverage is included, along with your medical and hospital coverage. Having the same health insurance company for both types of insurance provides the best care coordination and is now required by DMAS effective January 1st, 2025. In order to be eligible for a full D-SNP, Sentara Community Complete, a beneficiary needs to have Medicare Parts A and B, live in our geographic service area, be a United States citizen, meet the special eligibility requirements of being full dual eligible, and enrolled in a Cardinal Care Managed Care Medicaid plan. Some people are partial dual eligible because they don't qualify for medical benefits through the Cardinal Care program. They may still qualify for some help. Sentara Medicare has a partial dual special needs plan called Sentara Community Complete Select to offer extra support to those who are not fully dual. Our partial D-SNP was created to support members with lower copays and extra benefits. Sentara Medicare partial D-SNP members will also receive personal assistance from our care coordination team. If you are not fully dual eligible for both Medicare and Medicaid, you may still qualify for help. You may be able to qualify for a partial dual special needs plan. Partial dual eligibility is based on financial limits, such as how much you earn or own. A Medicare savings program may cover Parts A and B copays and deductibles. You can learn more about the different Medicare savings programs at medicare.gov. Members can apply for one of the Medicare savings program at dmas.virginia.gov. Only beneficiaries that qualify for the Qualified Medicare Beneficiary QMB program are eligible to enroll in the partial D-SNP plan. Plans include a dedicated care coordination team with extra benefits and coverage. Sentara Medicare is a service of Sentara Health, a trusted health system providing quality health care. As part of Sentara Health System, Sentara Medicare operates with the same mission, to improve health every day. Your health insurance needs are met with high-quality doctors, hospitals, and healthcare coverage. With Sentara Community Complete or Sentara Community Complete Select for your D-SNP, you will get hospital, medical, and prescription drug coverage packaged into a single plan. Plus, with no-cost extra benefits, you will have even more coverage than original Medicare for services like dental, vision, and hearing. Staying healthy is a team effort. When you enroll in Sentara Community Complete or Sentara Community Complete Select, you will have an entire team focused on your care. Along with your medical providers, you will also have a care coordinator to help you stay healthy and follow your doctor's recommendations. Let's discuss the D-SNP benefit highlights. With our Sentara Medicare D-SNPs, you will have access to the Essentials Benefits Allowance and Healthy Rewards program on one convenient Flex card. Members will receive a $350 grocery allowance on a Nation's Benefits prepaid Flex card each month to use towards thousands of healthy food options. Members can use the allowance at retail locations that operate as grocery stores, including Food Lion, Harris Teeter, Kroger, and Walmart. To be eligible for the grocery card, you must have a chronic condition. You can also order online through the Nation Benefits member portal or by phone. Home delivery through Nation's Benefits has no additional cost. Once a member qualifies for the grocery allowance, a cart will be delivered to their address within 14 business days. Eligible members will receive a combined allowance on a Nation's Benefits prepaid Flex card each month to use towards grocery, over-the-counter products, and qualified utilities. Members can use the allowance at retail locations including Food Lion, Harris Teeter, Kroger, and Walmart. You can also order online through Nation's Benefits member portal or by phone. Home delivery through Nation's Benefits has no additional cost. To be eligible for the Essential Benefits Allowance, you must have a chronic condition. Once a member qualifies, a card will be delivered to their address within 14 business days. We offer in-home support services. This is in-home, non-medical care that helps individuals with activities of daily living and basic care needs, including grocery shopping, board games, meal preparation, light housework, tech help, and pet help. There is a maximum of 40 hours per year for in-home support services. Members can receive meals after an inpatient or skilled nursing facility stay. The discharge nurse will work with the Sentara Medicare care coordinators to arrange meal coverage. We also provide transportation for a $0 copay. Medical transportation is included to plan-approved health-related locations, and non-medical transportation is included for members with a chronic condition to non-health-related locations like churches, grocery stores, senior centers, and plan-sponsored events. We offer comprehensive dental through DentaQuest with expanded network coverage. The max allowance per year is $4,000. We offer hearing aids. Members can receive one set of select hearing aids every year. This includes warranty, replacement coverage, and batteries. The max allowance per year is $2,000. Members will also have access to Silver Sneakers. This allows free access to Silver Sneakers live classes and workshops with over 200 workout videos from the Silver Sneakers on-demand library, along with thousands of locations and online fitness and nutrition tips. Sentara Medicare looks forward to serving you and your healthcare needs. Thank you.